Most people assume joint pain after 50 is just a natural part of aging, something you manage, not something you prevent. But research consistently shows that the majority of joint deterioration in adults over 50 is not inevitable. It is accelerated, often by habits that seem completely harmless or even healthy. Today, we're going to look at 7 mistakes that many people over 50 make when it comes to joint health, without realizing it. And make sure you stay until the end, because mistake number 7 is one of the most frequently overlooked problems doctors see in this age group. After age 50, several things change simultaneously in the joints. Cartilage becomes thinner and loses its ability to absorb shock as efficiently as it once did. Synovial fluid, the lubricating fluid inside your joints, decreases in volume and consistency. Surrounding muscles weaken, which means the joints themselves carry more of the mechanical load. Ligaments lose some elasticity. These changes don't mean pain is guaranteed, but they do mean that certain habits which were low risk at 35 can become significant problems at 55. Let's look at the first one. Mistake number 1. Resting too much when joint pain appears. When a joint hurts, the instinct is to stop using it, and in cases of acute injury, that makes sense. But for the chronic, low-grade joint discomfort that many people over 50 experience, extended rest is one of the worst responses possible. When a joint is immobilized or consistently underused, the cartilage inside it receives less circulation of synovial fluid, which is the primary way cartilage gets its nutrients. Over time, this reduces cartilage health and actually accelerates degeneration. The solution is gentle, consistent movement. Low-impact activity, like walking, swimming, or cycling, keeps synovial fluid circulating, maintains the strength of the muscles surrounding the joint, and reduces stiffness. Movement is medicine for joints, but it needs to be the right kind. Mistake number 2. Skipping strength training. Many people over 50 avoid strength training because they associate it with injury risk, or assume it's too demanding on aging joints. In reality, the opposite is true. The muscles surrounding your knees, hips, and shoulders act as shock absorbers. When those muscles are weak, the joint itself takes on more force with every step, every movement, every climb. Research has consistently shown that strengthening the muscles around a joint significantly reduces pain and slows cartilage breakdown. A better approach is 2 to 3 sessions per week of resistance training, bodyweight exercises, resistance bands, or light weights, focused on the major muscle groups around your most active joints. This doesn't need to be intense, it needs to be consistent. Mistake number 3. Ignoring body weight as a joint factor. Every extra kilogram of body weight places approximately 4 additional kilograms of force on the knee joint during normal walking. That relationship is well established. For the hips, the ratio is similar. Over time, even a modest amount of excess weight creates cumulative mechanical stress that accelerates cartilage wear. Many people are aware of this connection in theory, but underestimate its practical significance. A weight reduction of even 5 to 7 kilograms can meaningfully reduce joint load and slow deterioration. The solution is not extreme dieting, it is consistent, modest attention to caloric balance combined with low-impact movement that protects the joints while supporting a healthy weight. Mistake number 4. Not warming up before physical activity. Cold joints move differently than warm ones. Synovial fluid is more viscous, thicker, when the joint has been inactive. Cartilage is less pliable, Surrounding tendons and ligaments are stiffer and more vulnerable to minor tears. Many people over 50 begin exercise, yard work, or even extended walking without any preparation. The consequence is increased stress on joint structures that aren't ready for the load. The fix is straightforward. Spend 5 to 10 minutes before any significant physical activity doing gentle, low-resistance movement that warms the tissues around your target joints. For the knees, that might be slow leg circles and gentle marching. For the shoulders, slow arm rotations. The goal is circulation and mobility before load, not stretching, which is more effective after activity. Mistake number 5. Staying in the same position for extended periods. Joints are designed for movement. When held in one position for too long, seated at a desk, standing in one place, or even lying in a fixed posture, the joint structures compress unevenly, synovial fluid distribution becomes uneven, and surrounding muscles tighten around the joint in response. This is why many people feel significant stiffness after sitting through a long film or a car ride. Over time, this repeated pattern contributes to joint stiffness and reduced range of motion. A better approach is the 2-to-1 rule. For every 2 hours of sitting or static activity, aim for at least 10 minutes of varied movement, walking, light mobility work, or simply changing positions regularly throughout the day. Mistake number 6. Underestimating the role of hydration in joint health. Cartilage is approximately 70 to 80% water by composition. Synovial fluid is also water-based. When the body is chronically mildly dehydrated, which is common in adults over 50, partly because the thirst sensation becomes less reliable with age, joint tissues receive less fluid. Cartilage becomes less resilient, synovial fluid becomes thicker and less effective at reducing friction between joint surfaces. The solution is deliberate hydration, not waiting for thirst, but establishing a consistent intake of water throughout the day. For most adults, 1.5 to 2 litres daily is an adequate baseline, more during physical activity or in warm conditions. This is one of the simplest adjustments available and one of the most frequently overlooked. Mistake number 7. Treating joint pain as a separate problem from overall inflammation. This is the mistake that underlies many of the others. Chronic, low-grade inflammation, driven by diet, poor sleep, excess body weight, stress, and inactivity, directly accelerates joint tissue breakdown. Inflammatory compounds in the bloodstream degrade cartilage, reduce the quality of synovial fluid, and sensitize the nerve endings around joints, making them more reactive to pain. Many people treat their joint discomfort as a purely mechanical problem, while ignoring the systemic environment that is making it worse. The fix is addressing inflammation through the full picture: consistent sleep, a diet lower in refined carbohydrates and processed oils, regular low-impact movement, and stress management. Joints don't exist in isolation. They respond to everything else happening in the body. Joint health after 50 is not a fixed outcome. It is a result, and most of what determines that result is within your control. The changes described in this video are not major overhauls. They are small, consistent adjustments that reduce load, improve circulation, and lower the systemic stress on joint tissue over time. When done correctly, these habits can make a significant difference in how your joints feel and function through the years ahead. If you found this information useful, consider subscribing to this channel. We publish science-based explanations for the everyday health decisions that matter most after 50. And before you go, how long do you typically sit without getting up to move? Let us know in the comments below. If you want to continue protecting your body as you age, make sure to watch our next video. We'll be covering the 7 most common sleep mistakes people over 50 make, and how each one affects everything from inflammation to metabolism to cognitive function.